Hi, I'm James McJunkin, Regional Executive Pastor of the Philadelphia Baptist Association, and welcome to our workshop on the global impact of COVID-19 and vaccine distribution. We want to look at the phenomenon that's going on around the world, what the needs are, what we celebrate, what we should be concerned about, what we should be advocating for. And to help us, we've invited a medical missionary from International Ministries, Christy Engel, who's going to share with us and help us to understand the phenomenon. She's the Global Consultant for Health with International Ministries, also known as International Ministries of ABC USA, or formerly the Board of International Ministries, for those of you all who don't quite know the new name. And she's been working around the globe with IM for a number of years in Haiti and other countries. She's going to introduce herself and share some material with us. And we look forward to her presentation. And we want to say thank you, Christy, for coming and helping us out today.
You're so welcome. I'm thrilled to be here. And as everybody knows, this is a topic that you can go down a rabbit hole and just continue down that way. So I'm going to try and give you a brief understanding of what's going on around the world. And I really thank you for this opportunity to share with everybody. So I'm going to go ahead and share a screen here. It'll take me just a second and we'll get this going. Okay, so as we know, the global pandemic with COVID-19 began in December of 2019. And that's important because the name COVID-19 comes from, and I'm going to give you a couple of quick definitions at the beginning, but COVID-19 started in the year 2019, and that's why it's called COVID-19. That's why the disease was described that way. But first, let me give you a quick overview of who I am and what I do, and then I'll move on to some more information about what's happening globally. So I'm a pediatric nurse practitioner, and I am working in global health around the world, which seems like a very broad topic, and it is. It can include everything from education to helping out in natural disasters. And I've listed just a few things that about myself that you might be interested in. I was commissioned with International Ministries in the year 2000 as a medical missionary to go to the Dominican Republic. I served there for 12 years after having been a volunteer in Haiti for 3 years. So I speak fluent Spanish and Haitian Creole. And my work mostly in the Dominican Republic was with Haitian sugarcane workers and developing healthcare and providing healthcare to about 120 different villages in the Dominican Republic. I have worked as a global consultant for health or regional consultant for health since 2012, since leaving the Dominican Republic. And the reason I left the Dominican was I just felt God calling me out to something else. And when I originally left in 2012, I wasn't sure what that would look like. I visited several countries around the world, and finally another colleague came to me and said, you know what you need to do? You need to do what you do best everywhere in the world. And so that's kind of how that path began. I teach a lot about what's called asset-based community development. That's ABCD. And I've written some training programs, both in English and Spanish for that. And ABCD says you look at a community and you see what they do well. And you use those resources, those assets that they have, which is not always, and very often is not money or finances, but is actually skill sets that people have. And so helping a community who has always been told somebody else is going to come and do it for you, that they have something good to give, has been a real passion of mine for the last probably about 8 or 10 years. So I've been teaching this both with partners around the world and also churches here in the United States, and have developed a 7-day curriculum or a quick 3-day curriculum if we need to do it over a weekend. I've been working in over 25 countries since I took on the role of global consultant, and I've visited more than 30 on behalf of international ministries. I've coordinated American Baptist Church's work with the Haiti earthquake while I was living in the Dominican Republic. For the first 4 months after the earthquake, I would travel back and forth across the border to Haiti and lead mobile medical clinics there. I was there for the second earthquake that happened about a week after the first, and stayed on for 4 more months, providing care to some of the most needy neighborhoods in Port-au-Prince area. In 2014, this is what this picture is that you'll see. I was sent to Liberia to work with Medical Teams International. So I was loaned out by International Ministries to another organization who were doing a lot of community-based work and getting facilities opened back up to be able to serve after the Ebola crisis. And I've currently, since this year, I've not been able to travel. I've been working as a volunteer vaccinator since vaccines began at a mass vaccination site down the road from where I am right now. So that's what I've been doing and what I do most of the time these days. I work 3 days a week as a volunteer vaccinator, and it has been a fantastic opportunity to kind of see the other side of things of COVID. So let me give you a quick overview of the situation. And again, like I say, I'm going to give you a few definitions as well. So you may have heard several definitions, several terms, and used interchangeably, and they really are very different. So you may have heard the term SARS-CoV-2. And SARS-CoV-2 is the actual name of the virus that causes the disease COVID-19. And a lot of times people will use SARS-CoV-2 or COVID-19 or just generally coronavirus all as the same thing, and they are very different. Coronaviruses are a type of virus. The SARS-CoV-2 happens to be that type of virus and is very specific to the virus that causes COVID-19. And I know it's kind of confusing, but I think it's important to know those definitions before we go any further. So I'm quickly going to give you some overall general data, and then I'm going to look at 4 specific countries that I've been working with since the crisis began, and let you know what's happening in those countries, both the good and the bad, and what the future is looking like for each of them. As of today, and as I put the date on here as of April 22nd, for a reason. Even from this morning to this afternoon, I had to update my data on these numbers. The situation is changing very rapidly, and it changes very quickly to the numbers. For example, if there's a spike in cases in one country, yesterday may not have looked so bad in that country, and today will. And so I preface all of this to say, what I'm telling you is current as of today. But even as more data is collected overnight, these numbers could change drastically by tomorrow morning. It's really important that we have good sources. And at the end of this talk, I'll give you some resources to be able to find good information and know what's happening in the world. So as of today, as of about 4 o'clock this afternoon, there were 144 million plus confirmed cases in the world. And yesterday alone, there were almost 900,000 new cases of COVID-19 confirmed in the world. To me, that is just a phenomenal number. When we start thinking about numbers, I mean, how many of us live in towns of almost 900,000? If you think about, if you're in an urban area, yes, your town might be large, but think about some of these smaller towns across the Midwest, across the South and West, that are very small. They can't imagine 900,000. That would be wiping out multiple cities in their country. And that's just in confirmed cases. There have been, since the beginning of this pandemic, 3.062 million deaths. That number is beyond what I can understand. I cannot imagine over 3 million people dying in just over a year. And I think sometimes we can get very numb to the actual numbers that are out there. And it's important for us to look at that number and go, 3 million, over 3 million deaths. That's really significant and very important. And the loss of life is not just the actual loss of a life, but it's the loss of potentially income for a family. It's the loss of a support system for people. Children who've lost both parents or their grandparents or all of their extended family. I think this is going to have significant impact on our world coming into the future. And we need to be very aware of those numbers and not let us become numb to them. As well as those deaths, something very good is that almost 900 million vaccine doses have been given as of today. And that's in just the few short months that vaccines have been given. I think that's really important, but it's also important to note that that's not how many people are fully vaccinated. That's just how many doses. Because as you'll remember, the AstraZeneca vaccine, the Pfizer vaccine, and the Moderna vaccine are all 2-dose vaccines. So just because you've given a dose doesn't mean that the person who receives it is fully vaccinated. So I'll get into some numbers a little bit later about the actual impact of how many people are fully vaccinated in the world today. So this is just another quick screenshot that I made from the World Health Organization, which I think has phenomenal information. And you can see how many confirmed cases there are per region. So the World Health Organization divides the world up into different regions: the Americas, Europe, Southeast Asia, Eastern Mediterranean, Africa, and the Western Pacific. And then you'll see in each column here is a different week. Okay, so you'll see today's week is not yet completed. That's why there's lines through that last column. But you can see what the trend is. The trend is not going down. We are going up again all over the world. And you just look at that. I mean, I find that something I need to remember, that it's not just a single location. It's the entire world is on the rise for the number of cases. And so it's really important to not get tired of this, to not become... lazy is not a word I like to use, but just, again, numb to the reality of what's happening around the world. In the Americas alone, there have been over 60 million confirmed cases. And this is going to be a quick little video I want to show you. Again, this is from Johns Hopkins University, which is a fantastic resource for information to see what's happening around the world. Even in your own state, you can pick out your county and how it compares to other places. But they do a quick visual of what has happened. And in the US, it'll start out in the US in the last 90 days, and then it'll go to the world and what the situation is in the world. How I have had to watch that video several times, and you can look for it on YouTube, or I can send a link to Dr. McJunkin to pass to other people. But what I found fascinating by that was that these numbers are just so huge in comparison to all the other diseases that I've worked with in my lifetime. And for India, for example, to be increased by over 300,000 cases in a day. All of that information about all those countries was the increase in one 24-hour period. 314,000 new cases in India in the last 24 hours. And I think the actual number is a little higher. That video was made at 11 o'clock this morning. And with new data that came in, which would be India's overnight numbers, I'll show you here in a minute what those new numbers look like. So the 4 locations that I'm going to share about today are India, Bangladesh, Bolivia, and the Dominican Republic. So let's look at India here. So, and on these numbers, I just confirmed these numbers as of about 4:35 o'clock, and they've probably gone up even more since then. So India has a population of 1.39 billion with a B people. And of that population, they have confirmed over almost 16 million cases and over almost 315,000 just today. They have confirmed 184,000 plus deaths, and that's deaths that were COVID cases. So of the COVID cases, they've had 184,000 deaths, and just alone today, over 2,100 people lost their lives to COVID. They have been able to give 130 million vaccine doses, but if you look just after that, that's only 1.32% of the population that's fully vaccinated. Just over 1% of the population is vaccinated. In comparison, the United States is reaching nearly 30% of its population vaccinated. That's a huge difference. And there's a difference in privilege that I really want to talk about that I think we sometimes forget because we get bogged down in either the politics or either the frustration with the lack of freedoms that we have because of COVID. And we are so privileged in the United States to be able to have the money and the access to vaccines, to treatment, to healthcare facilities. And I think we forget that so many other places in the world simply do not have that same access. There are friends of mine around the world. I have lost friends around the world to COVID, and they simply died because of lack of medicines, lack of oxygen, or lack of facilities to be able to treat them. And I know their families would give anything to have them back and would give anything to have the access to vaccines that we have here in the United States. So my work in India has mostly been, if you can look on this map, has mostly been in this these red states on the upper right-hand corner. This is called Northeast India. And Northeast India is surrounded by Nepal, Tibet, China, Bhutan, Myanmar, and Bangladesh. It is only connected to the rest of India by this very small, narrow piece of land. And it's considered a very separate and different part of India. China has been trying to annex this part of India for a long time. So there's always border wars. And this is a very tribal area. You may have heard of Nagaland. We have missionaries, Katie and Taku Longkumar, who work in Nagaland. And you can look up their work and see some of the fantastic things that they're doing, especially with a new university that's being built. And my work has tended to mostly be with the hospitals and the nursing schools in those areas. And I've visited almost all of the states in that Northeast area. But what I found out just recently in the last week was that many of these places are Baptist hospitals. In fact, all of the nursing schools that I visited were Baptist started hospitals. And so American Baptist missionaries came over and began these hospitals and nursing schools. But they're considered private. The only people who are having access to the vaccine in India are people who are going to government hospitals. And so all of these private facilities, all of these Baptist hospitals and nursing schools are not being able to access vaccines. And so there's a real discrepancy. There's a real distinguishing between who is worthy or who gets the vaccine and who does not get the vaccine. So many of my colleagues in Northeast India have been quite worried that more and more of their friends and family and people in the church will be dying because they're not able to get vaccines to them with the facilities that they're supporting. One of the stories I heard from Northeast India early on was in the city of Guwahati and at the Satrabari Hospital, which Satrabari Christian Hospital in the city of Guwahati. And the medical director there talked to me about what happened when their first case of COVID was found in that hospital. the government came and put chains on the doors and locked the building shut. Nobody who was inside the building, doctors, nurses, patients, family members of patients, or friends who were visiting, nobody could get out of the hospital for at least 2 weeks. And it took almost 48 hours or more for anybody in the government to realize that they needed to get food and water into that facility. And so for several days, people were wondering if they were going to eat or have enough water. They were running out of supplies within the hospital. And imagine you have your first patient in the hospital early in the pandemic, and you're not sure what to do. So that's the situation that many countries were facing early on that didn't have the resources that the United States has had. And so Northeast India, after about this hospital, after about 2 weeks, they were finally allowed to let their employees and family members who were there visiting patients leave, although they did have to be tested. And then the rumors began about how to keep yourself treated and free of COVID. There were things like that you could hang around your neck. They were calling them special devices to kill the COVID virus. So all of this misinformation was going around. But India, up until just recently, was able to keep their numbers very low. They had a severe lockdown, much more stringent than what we had in here in the US. But when they placed that lockdown and they found that it was working, people began believing that they had a special immunity to the virus. And so they stopped wearing masks. They stopped doing the things that had kept their numbers low for so long. And now you will see numbers are skyrocketing. And part of that was that workers who were doing things like rickshaw pullers and things like that, or working in little tea shops, they went back to their country homes. They were living in the city and working and trying to make money to send back to these rural areas. And they went back, and from the information I've read, it was the largest mass migration in the history of India since 1947. And that was people who were afraid of the virus, and they were moving out and taking it back to all these rural villages, where, of course, there wasn't the level of testing and or treatment if somebody would get sick. So that has been the cause to some of this, this change in these numbers in India. It's also been said that one of the companies who's making the AstraZeneca vaccine in India. So India is well known for its medication manufacturing plants. And so one of the vaccines, AstraZeneca has a vaccine being made there. When they're not meeting the production numbers that they thought they were, they're about 2 months behind. And the recent data that I've read says, if India does not get this under control very soon, it will take more than 2 years for their country to reach 70% vaccination, because so many people will die, so many resources will be used. The vaccines, they're trying to get shipped out of India when India needs them. And so now the government has taken over and tried to keep the vaccines in India, which then means they're not getting to other countries where contracts have been promised. So it's a pretty severe situation in India, and we just don't hear enough about it on the news. So that's the situation there. Now let's go into Bangladesh. And as you can see from the map, India is just next to Bangladesh. Bangladesh is kind of squished into a little corner of India, of Northeast India, and then its other border is Myanmar. And you may have heard about some of the refugees from Myanmar showing up in a place called Cox's Bazar. Well, that's in the province of or the state of Chittagong, and it's down here along the ocean. And there's a huge refugee camp that has been started there of people fleeing Myanmar, which was also known as Burma, coming out of there and landing in the Cox's Bazar area. So there's a large refugee camp there, which has all of its own problems, not only for things like cholera and typhoid, overcrowding diseases, but now with COVID and it being a refugee camp and very little health care except from aid agencies from around the world, it has been suffering from COVID increases, as well as the flooding that has happened over the last year, creating even more severe issues with things like cholera and typhoid. So in Bangladesh, I work with an organization called Symbiosis Bangladesh, and they're based in Dhaka, which is in the middle of the country, but they also travel to all of the other states within Bangladesh. And one of the biggest works that they do is to women's savings groups. So they've started helping women in these small rural villages save money just by pennies a week. And these women's savings groups meet once a week. They collect money from each other. And then once they've collected a significant amount of money, they begin loaning it back out to themselves so that they can start businesses or buy a cow or start a fish farm or anything that will bring income into their family. And as the income comes in, they pay back their loan, and then the women's savings group has more money to give out. Well, one of the fascinating things that's also happening through Symbiosis Bangladesh is not only do they just learn about saving money and banking, and sometimes even learning math because they had no education. They're learning to read and write and do math and maintain bank accounts. But on top of that, they get health talks every week. So somebody from Symbiosis Bangladesh will meet with them and do a talk on why young girls should not be married before the age, or shouldn't have children before the age of at least 16 or 18, and how to do family planning and how to raise children with good educations and how to build schools. So they give them all of this information, this social information that will help them develop their communities better. Well, interestingly enough, within Bangladesh, the communities that are supported by Symbiosis through their women's savings groups and through some of their men's savings groups as well, are not having the level of infection that other communities are. And part of that is because each of the women in the community has been trained, that's part of the group, has been trained about good health and how to have preventative health measures. And so it's really clear to see that it doesn't take a lot of money and it doesn't take a lot of supplies to help with this pandemic, but a lot of it is information, appropriate and good information, which Symbiosis Bangladesh has been able to have and do within these communities. Now, the head of the organization in Bangladesh is a physician himself, and he was quite ill and at one point was expected not to survive with COVID, but has recovered and is continuing the work there in Bangladesh. And you'll see some of the numbers here. So the population of Bangladesh is 166 million plus. And of that, they've had 736,000 plus cases, which is less than 1% of their population. And they've had a little over 10,000 deaths. They've been able to give over 7.4 million vaccine doses. But again, that's only 1% of their population that's fully vaccinated at this point. There's a big discrepancy. There's also a question of whether or not data is accurate. So in all of these countries that I'll be talking about today, we have to remember that the data may not be fully accurate. Well, only the data that I've been able to find is what is reported. Whether or not that reported number is the actual number or it's a number that the government is allowing to be reported is a big difference. So in some of the countries, and Bolivia will be the next one I share about that's like this, they're not reporting. And they're not giving the information either to the World Health Organization or the CDC offices that work worldwide for anybody to have accurate and true information. And in fact, let's go on to Bolivia now and see what's going on there. So Bolivia has a population of 11.8 million plus. According to the data that they have given to the World Health Organization and other agencies, there's 293,000 cases since the beginning. There have been 12,000, a little over almost 13,000 confirmed deaths. And they say that they have given out 577 plus vaccine doses, which is again, only 1.56% of the population. Talking to my friends on the ground and people who live in some of the biggest cities of Santa Cruz and Cochabamba, what I'm hearing is they're not seeing the vaccines, and these are medical workers. So where are those vaccines going? Are they really being given out? In Bolivia, they're using, they said, the Russian vaccine called Sputnik 5. And they have, because Bolivia and Russia have a good relationship and often help each other, or at least Russia helps Bolivia quite often. There's been some question of whether the data coming out of Bolivia is accurate, because as you'll see in the map, what is all along its eastern border there? Brazil. And we know what's happening in Brazil. So all of the facilities, all of the hospitals, all of the towns along the Brazilian and Bolivian border are now overwhelmed with COVID cases. And it's with the Brazilian variant that is actually much more infectious. And so Bolivia's numbers are really high, but nobody knows the real number. And in fact, I work with, in Cochabamba mostly, an organization called the House of Hope, which was started by my colleagues, missionaries with International Ministries, JD and Rhonda Reed. And the medical ministry is there working, but the medical workers are either losing their jobs because the government doesn't want to pay the medical workers. So imagine in a pandemic and the government says, well, you need to keep working, but we're not going to pay you. How many of us would still work in the extreme circumstances that are going on with the pandemic if you weren't going to get paid? And so they're thinking they have to take care of their families as well. They have to be safe, and they're not being given enough PPEs or enough safety equipment, gloves and masks and gowns, all of those things. They know they don't have the safety equipment they need, and they're being asked to work several days in a row with no break and not going home. So several of my friends have lost family members. Thankfully, none of the medical personnel that I know have died, but some have lost newborn babies and children or their parents to COVID-19. The House of Hope in Cochabamba, Bolivia, and also now there's a new branch of it in Santa Cruz, where the Reeds are working. They do a lot of medical and dental outreach, but they also do work with children with disabilities and pastors and building churches and construction projects as well. And they're working in the poorest of the poor communities in both of these cities. So they're able to tell me what's really happening down there. And the reality is, they can't tell me the numbers, actual numbers, but when they look at the reported numbers, they know those numbers are much, much lower than the truth. And so I think this is a prime example of a disaster waiting to happen, because as the Brazilian variant is crossing the border and people are trying to get away from that, they're carrying it through with them into Bolivia. And Bolivia simply does not have the capacity to handle anymore. Let me quickly move on to the last one. I know my time is running out. So the Dominican Republic. The Dominican is a population of 10.9 million, which you see is the same population, or almost the same population as very close to Bolivia, but they're a much smaller area. And so when I worked in the Dominican Republic, I worked at the Good Samaritan Hospital in La Romana. And just recently, just in the last 24 hours, the State Department, U.S. State Department, has declared the Dominican Republic a level 4 travel advisory, meaning do not travel there. The cases are arising so quickly that you should not be going to that country. Unfortunately, because everybody who is used to traveling wants to keep traveling, tourists have been continuing to come into the country, and I believe is part of the reason for those numbers going up right now. As you'll see, 1.5 million vaccine doses have been given, and it's better than in the other countries that we've shown. 5.64% of its population is fully vaccinated. I know the Good Samaritan Hospital that I work at has been a part of that vaccination process. They're getting the Haitian sugarcane workers, especially the elderly that live in the villages around La Romana, to come into the hospital. They're busing them in and getting their vaccines there at the hospital. So that is a bright spot in what's happening in the Dominican Republic. And monies and donations have been able to be given to help as well from both international ministries and their partner organizations. So what can be done to help? Very quickly, let me just share with you what has happened with 1 Great Hour of Sharing with the COVID-19 relief grants. There were 91 grants provided for a total of $262,500. And that was to countries anywhere outside of the US. More grants were also given to facilities and locations within the US. But outside the US, 91 grants were given in 41 different countries. The colors of these countries that are the darkest were the ones that received multiple grants. The green colored countries received just one grant. So you can see in Mexico received several, Nicaragua, and then over in, let's see, that's not Myanmar, I think Indonesia and in India as well received grants to help them, as I shared about. And here are some other ways, and then we'll get to some questions here. Ways you can help personally is to volunteer at a local outreach. What I'm doing, I'm not getting paid, but I'm vaccinating people because I have that skill set. Well, maybe you say, I'm not a medical person, I can't do that. Well, what if somebody just needs runners? And the organization I'm volunteering with, they have people who direct you to a vaccination site, people who help you get a seat in the observation area, people who register you. They don't have to be a medical person to do those things. So learn about what's available within your local community and how you can join that effort. Learn about a specific country and the needs that they're having, and then share that with others. Educate others as you educate yourself, so that we're not blind to what's happening around the world and only focused on what's happening in our own country. Commit to pray for leaders. And I'm talking about leaders of the church, but also leaders of each country, that they make good decisions and wise decisions and decisions that benefit the majority and not just a few. And if you speak multiple languages, learn if there are churches or places around the world that just need a word of encouragement. How can you join with those churches, meet with the pastor online once a week or once a month to just encourage them and pray for them and let them know that they're not forgotten around the world. And finally, you can give to partner organizations like the House of Hope, or Symbiosis, or the Good Samaritan Hospital, one of the universities or nursing schools or hospitals in India. All of those partner organizations, we can help support with finances when we ourselves can't go, and there's nothing more that we can do. We know that they need funds to keep those facilities going. And so I would encourage you to learn about the places that really are touching your heart and find out how you can connect with them in a better way. So now it's question time. I gave you a lot of information in a very short amount of time, and I'm sure you have questions. Thank you.
Thank you. We really appreciate the work you're doing around the world, and it's good to know what American Baptists are engaged, how we're engaged in this ministry. I've asked two members of the board of directors of PBA, the Reverend Dr. Suzanne Kershaw and Reverend Michael Robinson, if they would respond to your presentation, and they have questions for you that they will ask at this time.
Wonderful.
Sister, thank you so much for the great work that you're doing domestically and abroad, especially abroad in foreign lands. God bless you. I'm curious about a couple of things. We know that from the research that Australia, for whatever reason, has an extremely low occurrence rate of COVID cases, only 29,000 cases out of the whole country, and only 910 deaths. I mean, one death is too many, but out of an entire country, only 910 deaths. What can we learn? What can we glean from Australia that they're doing right, that maybe we can implement here domestically in the United States, and also a part of those other global communities that you highlighted, like India, that has high spiking cases right now?
Yeah, so I actually have several good friends in Australia that live in Australia, and they've been very concerned about me, and they have reached out to me throughout this whole year. One of them is a paramedic, and she has talked to me about the fact that they just didn't have cases early on, but why? Okay, so part of it was that they locked down early on, and they locked down and everybody followed the rules. Nobody argued with the government. Nobody said we shouldn't do it or we need to do it this way. It was not a political issue, which is very much what it became here in the United States, unfortunately. And I'm not taking sides on any side. I just want to say that when it's something that is healthcare related, is made political, people will die. And so they couldn't understand. We kept talking about this, and they couldn't understand why we were so bent in the US on having our own freedoms at the expense of the lives of other people. And they kept saying, if you know that staying home and putting a mask on and reducing travel, all of that saves lives, why are you fighting it? Why are you saying that your personal freedom is more important than the person next door to you's life? And so I fully believe that we have sort of dug our own grave here in the United States and in some of the countries that have really refused to follow guidance. And that's what's happening. I can't be so critical of some countries. I understand that, like the Dominican Republic, it's very tourism based. And when your economy is based on tourism and people aren't coming, people continue to die because they're going to die of starvation and other things. And you'll see the malnutrition numbers have gone up significantly around the world as well. But I really believe that the issue in some of the countries, why they've been able to hold it back, is that citizens said we care about each other more than we care about our personal freedom. And we're going to do the things to save our brothers and sisters.
Thank you.
I think you're on mute.
Hi, Christy. Wonderful
Hi.
presentation. And as everyone has said, well presented. My question is one that really looks at the overall disparity. Given the health disparities that COVID has exposed, how do you recommend that we embrace this moment to transform healthcare in our communities and in our country?
Mm-hmm. Yeah. Wow. What a question. If I could solve that, it's like, I can fix hunger around the world, right? So I read an article recently that talked to this and why there's vaccine hesitancy, why there's hesitancy to do things that science proves, which parts of science you believe and which ones you don't, and all of that. And it basically came down to what truth are people basing their decision upon? Is it truth from a scientist, a doctor, or a blog they read, or a social post that they read? And so they said, you're not going to be able to fight that at that level. What people need to know is that they can trust the information they're given. And so you trust generally your loved ones. You trust your friends. You have this group of people that you listen to. In fact, some of the most misinformation I've seen has been coming out of even small Bible studies of people who are in no way healthcare related, but somebody found a blog and they shared it with their whole Bible study and it wasn't true, but now everybody believes that. And it's passed on then through the church that way. So the article was talking about, you need to go to a loved one and say to them something like, I know you don't trust the World Health Organization or the CDC, but trust me. This is my experience. This is what I know to be true. And that changes the conversation. Then it's not a political thing. It's a relationship thing. And so as you build strong relationships or you have these strong relationships within the community, we should be leveraging them in a good way, not to manipulate or anything, but to leverage that trust that we have with family members or church leaders, that they can get get good information and share that with their congregations, because life is important and it's not the politics. It's get rid of all of that and let's get back down to the basics of caring for each other.
Thank you.
I want to follow up with a question.
Sure.
So what do we need to be sharing then about what's going on globally? What do we need to understand about the picture of the spread of the disease and the distribution of vaccines? What do we need to know? What do we need to be telling one another?
Well, first of all, we need to recognize that we live in a very privileged country. We have access to money and healthcare, and I say we in a very general sense. I recognize that there is a difference within communities of who has more access or who has better access. I recognize that. But even in some of our poorest communities, they still have more access than my friends in India or in Bangladesh or in the villages outside of La Romana in the Dominican Republic. Our access in this country is greater. And so I think we need to recognize, again, that this is not a political issue, or we can't make it a political issue. It's a matter of caring for each other as human beings. And I know I try very hard not to offend somebody, because I really don't. I want to be full of grace with everybody. But there's a strong patriotism in the United States that sometimes gets in our way of helping our neighbors, and sometimes gets in our way of seeing the need around the world because we put ourselves as the priority. Well, I can guarantee you, if India explodes with cases, it's going to be everybody's priority then. It's going to be forced upon us. And so some of what we can do is to say, okay, let's kind of tear down some of these walls and these barriers that we put between ourselves and the other, whoever that other is, and try to begin to see this whole situation from their perspective. And how do we do that? If we, I don't have, let's say you say, I don't have any friends in India, or I don't know anybody in India. Well, I think the first step is to start making those connections. Reverend Dr. Ben Chan, who is my direct supervisor at International Ministries, is over that region. He would be an ideal person to connect with and say, you know what, can you share with our church more about what's happening in India? We really want to learn. We want to feel more connected and less separate then. Because I think as those relationships then begin to build, you begin to see people as a person and not just like a place. Jose in Bolivia, or Dr. John in Northeast India. They become people, and that relationship piece is what we most need to build on to make that change.
I know that we've had a lot of high hope for Johnson & Johnson's vaccine. Mm-hmm. And with the recent controversy of only 12 people out of millions that have been vaccinated, only 12 people developing those rare blood clots kind of halted everything. Mm-hmm. But the high hope for Johnson & Johnson was because you don't have to refrigerate it. It's a one dose, vaccination. And for countries like Africa, where there's a growing number of infection rate, India, you cited, mm-hmm. and others, where this one dose unrefrigerated vaccine was seen as a real big breakthrough in comparison to some of the other vaccinations. How does this now impact the global community with vaccinations, now that we have Johnson & Johnson's on this halt, and now people being a little hesitant about maybe even taking it now?
Right. Yeah. So I think there's two perspectives to look at this as. The first is the perspective of Americans who have a choice between which vaccine to take, and somewhere in the world who may not have a choice. That may be the only one provided to them. And if it is the only one that's provided to you, is this minute chance of getting this clotting disease, this very small chance, and then even smaller chance of dying from it, is that worth the risk of avoiding that? And so you don't get a vaccine, and then COVID's chance of severe long-term health issues and death is much, much higher. So people have to begin weighing the risks, like which risk is greater. And so I think if we look at it from the perspective of somebody else who may not have another choice, they can't have those extreme freezer temperatures in the Sahara, or in Egypt, or some of these other places that may be just so difficult to get something to. So they're going to have to look at this vaccine and say, okay, my risk of getting this is quite small, but my risk of getting COVID is very high based on my congested neighborhood that I live in or something else. So I really do think it's a different perspective. If you're in the US and you can say, okay, well, I can choose something different, then it doesn't matter to you as much. But it does feed into this vaccine hesitancy that none of the vaccines are good and something's going to be found out later. And I think so people are really going to struggle with that more when they have a choice. When you don't have a choice, I think most people will still take it. And I perceive that Johnson & Johnson will be back out being given again very soon.
Thank you. We're going to move toward closure, but I want to give Dr. Kershaw, one quick question for you, and then we're going to have to end the session.
Okay.
Yes, Christy, you talked about us needing to know people in these other places and not being disconnected. How can we make sure that we are contacting the right people, making sure that we have the right IM people that we're connected with? Should we go to the website, or do you have a listing that you can give us so that we can make sure that we know the needs?
Yeah, I'm happy to send a list to you so you can make that available to people when they watch this video, that they would have that resource, as well as resources that I have for where to find good information. I can send you both of those things. But otherwise, if people don't want to wait for that list or they lose it, go onto the IM website, and what you'll see is a list of area directors. And it'll be the area director over Europe and the Middle East, or area director over Latin America, the Caribbean, and Spain and Portugal. And figure out in your congregation or in your small group or Bible study who it is that you want to know better. Who do you want to develop relationships with? And then look up the area director for that region and ask them how you can get connected with somebody involved in that ministry.
Thank you.
You're so welcome.
I wanted to say thank you as well one final time to you, Christy. We really appreciate you. And Reverend Ben Chan is a former member of our board of directors. I think he just went off the board last year. So we know how to get in contact with him. And that would be a great starting place for people who are interested in the countries that you talked about today.
Perfect.
I want to thank the board members for their willingness to participate, and it is our prayer that this has been a meaningful conversation for you and a wonderful time of sharing. Let's close in a word of prayer. Gracious God, we thank you for this day and for Christy. We ask you to bless her and bless all those that are part of international ministries. Keep them strong and vibrant, and help us to be the kind of servants that you'd like for us to be. Global servants, people who know how to care about others outside of the United States. Thank you for this time and for this day and for this annual meeting. In Jesus' name we pray. Amen.